Hi, myself is Shalini Bharadwaj. You are watching ITV Networks Medically Speaking. So today we are going to discuss with the doctor this that what kind of connection is between a psychic problems and COVID-19. So we have with us Dr. Rajiv Mehta, who is a psychiatrist, who is a neuropsychiatrist and geriatric psychiatrist from Sir Gangaram Hospital. Sir, welcome to Medically Speaking.
Thank you.
Sir, what kind of problems you are getting from the patients who have been already recovered from COVID-19 and who are still in the process of recovery? Is there a kind of psychiatric issues are coming?
There are a lot of psychiatric issues coming. The coronavirus is impacting the neurons of the brain also. So mostly what we are seeing is depression and anxiety and the worsening of previous illness, whatever the patient was suffering from. If the patient was suffering from, let's say, dementia or basically psychotic disorder, then the worsening of that disorder is also seen after corona infection, after recovery and during the corona infection also.
That means, sir, COVID-19 is causing psychosis, we can say this.
No, we cannot say this directly. Mostly it is causing neuroinflammation, which is leading to depression and anxiety. But if the person was previously suffering from psychosis, then that original disease was magnified.
Sir, as you said, the people are suffering from dementia also. So these are the, the problems occurring after, post-COVID or, at the during the time of COVID-19 treatment.
Both the things are right, and dementia is not because of COVID. The dementia was earlier there because of the age, the neuronal degeneration, but the COVID increased the intensity of the illness.
What other, sir, psychological problems people are going through this?
See, the main psychiatric issues are depression, anxiety, panic attack, OCD, generalized worries. The reasons for that, if you say corona directly causes this, but the corona has changed the world in such a manner that there are other stressors also, like job loss, children remaining at home, people remaining at home, domestic violence. These are the other environmental problems which have occurred due to the lockdown. Lockdown occurred due to the corona. But if we say directly corona, the corona directly is causing depression and anxiety majorly. But the other stressors are contributing to that. They are further increasing the depression and anxiety levels in many persons by causing various socioeconomic changes.
Sir, is it related to some kind of age group also? In youngsters, such problems are coming, or old age people are also going through same psychological problems?
See, everybody is impacted, be it little children, be it old age group, everybody has been impacted. And it is majorly the middle age group which has marked job loss, the financial loss. So due to that, they are the major breadwinners of the family. So they are the most impacted person.
So,
But
sir,
as you see, children are living at home, so they are facing the parental abuse. The parents are displacing their emotions on the children. The children are all the time online. So a digital consumption of time is increasing, which is causing their physical weaknesses, eye problems, headaches, irritability. So this is how the children are impacted by the parents and by the online studies. The adults are hampered because they have many losses, many worries, and then they get displaced to each other. So there are a lot of cases of domestic violence, suicide, depression, anxiety. Similarly, the old age group, they are unable to meet their family members or they are being bound at home. The children are much worried. They are not letting the oldies to go out. So the company in which they used to spend time, that has gone. So the loneliness has given rise to depression and anxiety in them also.
sir, what is the cure for particular problems? Whether they should go for the psychological treatments, and what are the medication it involves?
See, there are two things. One, if it is really interfering the life, then it has to be treated with the help of medicines and counseling. but the medicines are a mainstay of the treatment which brings an earlier relief. Number one. Number two, then we have to think, introspect, what really has been lost. Is it really a loss or is it only an assumption? Definitely, when we have life, we can always build a lifestyle. Lifestyle has been down. It is totally agreeable. But whether they can sustain the life for few years or not, that has to be introspected. Whether they can live with the downgraded life or not, the demotion or not, that has to be introspected. So if they can live, if there is a life, slowly and slowly they can build the lifestyle again to the previous level. At home, they have to understand that each and everyone has been impacted because of the corona. So it is a time to have bonding rather than displacing emotions and causing hurt to each and everybody.
Right, correct, sir. That means, social awareness is very important, and family also plays a vital role in particularly healing such patients.
Definitely, the home environment plays a very significant role in the healing part. The stressors is away, then the illness is also dampened, decreased.
Thank you so much, sir, for joining us on Medically Speaking. Thank you so much, sir.
Anytime, anytime.